Diabetes, everything you need to know. Hello to all my subscribers and anyone new to this channel. I am Dr. Parker, and please continue to watch this video from Fit and Wellness Over 50 about what is the difference between type 1 and type 2 diabetes. What is diabetes? Diabetes is a chronic disease in which the body either doesn't produce enough insulin or can't use its insulin properly. Simply said, diabetes is a disease that affects the way your body handles sugar. It is caused by a lack of insulin, which is produced by the pancreas to help move sugar from the blood into cells. This causes blood sugar levels to rise, which leads to serious health problems. Now, the symptoms of diabetes depends on the type of diabetes you have. So keep watching until the end to learn more about this disease. You will understand the causes, diagnosis, preventions, complications, treatments, and recovery. Now, there are two main types of diabetes, type 1 diabetes and type 2 diabetes. Now, the symptoms of both types are similar. And in this video, we will explore the causes and symptoms of both types. How do you know if you have diabetes? What are the symptoms? Now, the symptoms of diabetes are not always clear. Some people have no symptoms and others have severe symptoms. So if you're experiencing any of the following, you should see a doctor, such as unexplained weight loss or gain, increased thirst, increased hunger, feeling tired or lethargic. Now, type 1 diabetes is an autoimmune disease, which means that the body's immune system mistakenly attacks and destroys the cells in the pancreas that produces insulin. Type 1 diabetes develops when the pancreas stops producing enough insulin. Type 1 diabetes affects both children and adults. However, it is more common among children under the age of 14 years old. It can also occur at any time during life, but it usually starts during childhood or adolescence. The symptoms of type 1 diabetes were started earlier, such as excessive thirst and increased hunger. It can also include unexplained weight loss, frequent urination, blurred vision, nausea, vomiting, and stomach pain. Now, type 2 diabetes usually has no symptoms in the early stages, but the symptoms may develop over time as your body becomes less responsive to insulin. It occurs when a person doesn't produce enough insulin or just can't use the insulin properly. Type 2 diabetes is usually caused by lifestyle factors such as obesity. Now, 90% of people with type 2 diabetes are overweight when they are diagnosed with it. Also, a lack of exercise. Other risk factors include age, family history. It affects people of all races and ethnicity. High blood pressure, or high cholesterol. Now, this leads to high blood sugar and over time can lead to serious health problems like heart disease, cardiovascular disease, nerve damage, stroke, blindness, kidney failure, and possibly limb amputation. Now, some of the symptoms of type 2 diabetes are also increased thirst, increased hunger, and frequent urination, especially at night, along with weight gain or difficulty losing weight, fatigue, and blurry vision. Also, tingling or numbness in your hands or feet, and the slow healing sores on the legs or feet. How is diabetes diagnosed? Now, the diagnosis of diabetes includes the following: a fasting plasma glucose test, a 2-hour plasma glucose test, or a hemoglobin A1C test. Now, oral glucose tolerance test. Now, this test requires you to drink a glucose solution containing sugar. It evaluates the blood glucose levels before and after consuming the solution. So there are symptom checkers for diagnosis of the disease. Now, they're a key part of our healthcare system. There are many different types of symptom checkers, such as online, mobile apps, and even kiosks in pharmacies. Now, these tools can be used by patients for self-diagnosis or by the doctor to diagnose patients when they have difficulty figuring out the cause of a patient's ailment. Now, the symptom checks as examples. There's the WebMD system, there's the Mayo Clinic system checker, and the SimCat. Now, that's a system database. But just please remember that these symptom checkers are not a replacement for seeing your doctor. So how do you care for a diabetes person in a daily life? Diabetes affects the way your body breaks down food into energy. It also affects the way your body stores and uses sugar. Now, the following are some tips on how to care for yourself as a diabetic person in your daily life. Living with diabetic requires constant monitoring and management of the disease. The best way to live with diabetes is following a healthy lifestyle, such as eating well, exercising regularly, insulin injections, and or taking medications like metformin to help with the glucose metabolism. Here are 3 ways that you can reduce your risk of developing diabetes. 1, eat a healthy diet that is high in fruits, vegetables, whole grains, and low-fat dairy products. Number 2, be active for at least 30 minutes a day. Number 3, maintain a healthy weight or lose weight if you are overweight or obese. Conclusions. The goal is to keep your blood sugar levels as close to normal as possible without causing low blood sugar. The treatment goals are different for each person and depend on their age and other health conditions. And please remember that uncontrolled blood sugar levels and the high levels of glucose in the bloodstream can lead to serious health complications, such as heart disease. The video concludes that managing diabetes is a lifelong commitment that needs to be made. Diabetes management is not something that can be done in a day. Now, to manage diabetes, you must commit to it and work on it every day. And if you find this video to be informative, please give us a thumbs up and click the subscribe button to be notified weekly of more informative videos. Thank you for watching, and please share your stories.